I know one of the things here that you're working on is a book. I know it's untitled. I'm not going to ask you too much, but do you have the general
Yeah.
idea or
Yes.
framework of what you'd like that book to be about?
Well, the book's written.
Oh,
It's
it
more,
is. Okay.
yes, the proposal is going to go out. So the A publishers, right? The proposal is going to go out. So it's on its way.
Okay.
But the idea with my book is about wellness and health in the childbearing years.
Mm,
So there are, a lot of people are having kids later now, and they're kind of thinking about it, but they're not sure. And I have so many people, and even just friends or in casual conversation, people say to me, what do I do
hmm
to get my body into just a healthier me
Yes.
before trying to conceive? And some of them say, I don't even know if I'm definitely going to have a kid. It's a complex time with having children. I think
Oh,
people are
yeah.
in a thought process of it. They decide not to for many, many conscious reasons. But a lot of people know their health isn't optimal, but they know that there are things they can do. And, a big part of the book is on what we're talking about with the energy medicine, the stress, the
Yeah.
kind of doing some, if it's a great time to start doing some deeper emotional work on oneself and, some ancestral relational work. I mean, my experience having a kid just blew up everything anyway. And I was like, okay, I'm going to do more work and try and grow more for them.
Yes.
But I do think there's some lovely work you can do before. And it's a great time because you do have a little bit more time then. And then of course it covers nutrition and 21st century toxins and healthy detox and supplements that you can take before and then even through it into if someone were to decide to have a child.
Yeah.
Um,
As
so
you
go
know,
all
like
the
toxicity is such a big deal, right? When
yeah.
you're trying to have
Mhm.
a child, that idea of, bringing in another biological being, you have
Yeah.
to do it in the right environment that's non-toxic. So I'm sure a portion of it has to, you have to get into that idea of detoxification.
Yeah, mercury, heavy metals. Mercury is an estrogen mimicker. And
Mm,
so many people are high mercury now. It's so that's one that you really can get down. So there are things like that
mhm.
that are work on. And I try to do it in ways that are not, explain it in ways in the book that are utterly overwhelming to people.
Yeah.
And a lot of the books on gut health, as you know, I love talking about gut health. But so that just clearing up the gut alone can be so helpful. And then the gut brain connection. So that, and again, the stress is such a huge part of there's a lot of complex reasons for fertility issues, but stress is huge. So I cover all of that in the book.
No, it's an
Uh,
incredibly important topic. I truly believe one of the greatest threats we face, aside from just general health, meaning so many people being
mhm,
so chronically ill that we just can't keep going as a
mhm.
species, is this idea of infertility, of actually becoming
Yeah.
such a toxic, species that we are
Mhm.
unable to procreate. We are
Yeah.
unable to give birth. And that is true as we become more and more toxic. You will not be able, you see the birth
Yeah.
rates go down and it's harder. It's what now I think in the
Yeah.
next 20 years, something like 50% of people will need IVF or seek it, and doesn't even mean that it will work.
Right.
We're
Yeah.
going towards this trend of it's much harder to conceive a baby. And we have whole,
Mhm.
societies that are on the downturn, Japan and others that are losing their population. Um,
Massively. Yeah.
yeah. And, when you were
Yeah.
talking about that, it brought up, like, I'd seen something like about it today, and it's from Dr. Patrick Engel, who's a dentist. And he said, treating gum disease prior to the second trimester of pregnancy has been shown to reduce the number of preterm low weight babies by 80%.
Yeah.
Stuff like that, you just don't
Oh,
know, right?
there's dental
No
health
one
in my book.
tells you
Yeah.
this.
Yeah. There's dental health in my book. Like your teeth are
Massively
really important.
important.
Yeah. And if there's any mercury in the mouth, the studies on mercury
Right.
with the feet, get it out of the mouth. There's yes, dental health, huge, right? So even just that is a simple, basic thing people
Yes.
aren't told. So, yeah, exactly.
No, that's
Exactly.
that's amazing, and a great idea for a first book. So I can't wait till that comes out, hopefully sometime soon.